what are some common skincare habits that people are doing that is a big mistake?
All right, where do I start with the list?
Give us your top 3.
All right, too many steps creates chaotic skin, and like lots and lots of serums and things. One serum morning, one serum evening should be enough to give your skin all the essential. Spray on SPF is an absolute hate. People give it a false sense of security and they love it because they feel like they're wearing nothing at all. And the irony is because you probably are. Overwashing, foaming cleansers and acne patients going, yeah, I've got too much oil, so I'm going to cleanse more. And they use stripping, foaming things. All that does to your skin's biofeedback mechanism is tell it to go into a reactive overdrive to make more oil. And then you go out of balance and you get more pimples and acne again.
Feeling confident in your skin is so much more than what you see in the mirror.
And how can you feel good? Well, that starts from within.
Welcome to the In Your Skin podcast. I'm Christy.
And I'm Anna. Join us each week as we sit down with world-leading experts and thought leaders to delve into the latest insights, groundbreaking research, and cutting-edge advancements in wellness, longevity, and beauty.
Dr Natasha Cook, thank you for joining us on In Your Skin. You're a leading dermatologist, skin health expert. You are also an entrepreneur with your own line of skincare products. What led you into wanting to learn about skin health and starting a career in this field?
Well, thank you both for having me. I'm super excited to be here, and I loved all the questions you proposed there. So let's get into this and get more than skin deep.
Yeah.
So believe it or not, I had really bad skin growing up. I suffered from an extremely rare autoimmune condition that attacked my skin and mucous membranes. And it was triggered by cold viruses. It's known as erythema multiforme. And so from the age of 8, multiple outbreaks a year up until 18 when I kind of grew out of it. So I knew what it felt like to feel disfigured, to be bullied, to be teased, to feel itchy, uncomfortable. I'd have boracic acid ice baths. And, and I even ended up having misdiagnosed treatment in the form of radiation therapy to my mouth area with a smart dermatologist not thinking that radiating my mouth would kill the cold sores and therefore my immune system would stop reacting to them, which basically didn't happen. So as a result of that, I've got an increased risk of thyroid cancer, head and neck cancer, and oral cancer. And I guess probably I channeled myself with a feeling of like confidence, low self-esteem, but I was a highly creative child and I was in those kind of gifted and talented gigs and smart. And I probably did hyper-concentrate my efforts into those pursuits as part of my own personal healing. And, being indoors in your own room where no one can see you, you can make up your own imaginary world. And in some ways that gets you through. And I think then I got into med school. So I did grow up in regional Australia. And I think probably subconsciously it was a real big motivator for me. I never thought consciously about derm once I got out of med school, but I met this lovely nurse at Manly Hospital and her dad was a pioneering dermatologist and bringing all this technology back from America in lasers and very progressive areas of where derm was just starting to go. And I was about 23 at the time and being disappointed with the way the hospitals were run. They weren't really orientated towards outcomes, prevention and patient care. I was going to leave and join a management consulting firm, believe it or not. But meeting this nurse and then meeting her dad and seeing his clinic, I thought, wow, this really resonates with me and I can see myself being here in a decade's time, running my own business, making great outcomes, helping people in their skin. And then obviously these laser devices and the pioneering technology that was coming through was amazing at reversing scarring, which I suffered from. And so I ended up being able to treat that for myself. And then the rest is kind of history. So it gave me a really clear insight to have empathy, to understand how it made you feel from the inside out. But also, personal experience and then having the intelligence and the capacity to learn information like that, it was just my motivation to help other people feel better in their skin because I could really relate to how that made me feel for most of my formative years on the planet. So very organic, very passionate, So, and sort of I think you look back at the subconscious motivators and you're like, oh yeah, no wonder I end up being a dermatologist, Heal thyself, then heal others.
Yes, which is, what we all love to do, don't we? But
yes.
No, and I think having that empathy, especially when you're working with clients these days that come in with skin issues, what are you typically seeing in your practice?
Okay, so nowadays, I've dealt with everything from disfiguring, scarring, hair loss, from lupus and autoimmune diseases to skin cancer, to acne, to scarring, to pigment, to then just making skin better. Nowadays, I've sort of refined what I do because I can't do everything, and I like doing a handful of things and being really good at it versus trying to be great at everything to everybody. It's technically impossible. So nowadays, my key things, I still do skin cancer medicine, skin cancer surgery, and skin cancer surveillance. I've had a lot of patients who've seen me now for a couple of decades, and so I have a real strong grounding in that. I like to be connected to the bowels of the medical side of dermatology as well as the aesthetic side. And I think that also keeps you balanced as a human being, and there's a big need for it in this country. But I focus on also skin regeneration, prevention aging or prejuvenation. So how do we keep the best skin of our life for longer? And with technology and lifestyle and other things and what we use on our skin every day, that's now possible. And then I also focus on what I refer to as the 6 key skin concerns and most of us have at least 2 or 3 of these, which is why having skincare that can help you with all of them is really important. That's aging or photoaging, sun damage, pigment, sensitivity, acne, congestion, and dehydration. So we deal with all of those conditions, and we have about 15 plus laser and energy-based devices in my clinic that can pretty much address all of these kind of concerns that people come in with. And it's really important, I think, to have diverse technologies because no one skin is kind of the same. Skin needs are, but being able to diagnose the collection of pathology and match each pathology with the appropriate technology will give my patients best outcome.
I like how you say no skin is the same because it isn't, and we all have our different concerns. When it comes to living in a place like Australia, our environment is very harsh.
Yes.
How does it differ from other environments, and why do Australians have to, I've heard, look after their skin a little bit more?
Well, where Australia's situated geographically on the planet, the tilt of the earth, we're the closest to the sun and we get the most UV radiation anywhere else globally, pretty much. We have long summers, sunny days, and we're an outdoorsy, sporty nation. So we know that now, and this is something I might tap into more, that our DNA does not define our skin destiny. 80% of skin aging is around our lifestyle choices and how we live, not what we're born with. So we can reprogram our skin. As a result of that, if it is environmental, we have the harshest UV. Also, infrared heat is equally as damaging as UV. It just does it slower, right? So we're hot, we've got high UV, we're close to the sun, and we've got a depleting ozone layer, which is a dynamic state. So we cop it the most. So therefore, we need mediocrity when it comes to what we're using, whether it's in our skincare, prevention, or whether it's in SPF, does not cut it in the country and down under, but it has provided me with the perfect natural lab to refine making skin products that actually do what they promise in good concentrations of actives and feel-good formulations and work in this environment. So if they can work here and they can pass testing here, you basically got a high distinction to work anywhere else in the world. I hope that kind of makes sense in answering the question.
Yeah, well, you talk about the environment to have the best skin possible. What are some of the things that we should be doing from a lifestyle perspective to prevent aging? Because we're all going to be aging at some point.
Yes, aging is good. It's
we
more
are
time
aging
on the planet, right? That is a good thing.
Yeah.
It's just doing things well. So I call it increasing our skin span. It's something that I've coined, which means better looking, healthier skin for longer. And it's kind of like that thing about longevity, well, being 95 and demented versus health span being 95 and healthy and independent as much as possible, right? So we want to look at how can we maximize skin span, which is healthier, high functioning skin for longer. So as I kind of tapped into a little bit earlier, we have 80% control of how our skin is going to deteriorate, right? Or age or appear or function. And if we look at the buttocks skin, unless you're a naked sort of sunbaker, intrinsic aging is not that bad, right? Like the decline in collagen, elastin fibers, which is our support structures of our skin, it's actually not that bad. Everything is the environment, and the biggest factor obviously is sun, then UV, then pollution. But then we also have our other lifestyle factors, stress, sleep, nutrition, and smoking. And so those key 7 factors, so UV, sun, also including visible light, the electromagnetic spectrum is more than just UVA, UVB. We've got heat, infrared, so those saunas we maybe need to question.
Really? That's what I was going to ask.
Yeah, I'll come back to that.
Yeah, can we talk about
it will
that a
give you
bit?
sensitivity
I've
and
got one at
rosacea.
home. No.
Yeah.
We've got to question those because heat does the same damage as UV, but just slower as far as degrading collagen, increasing pigmentation. So we've got UVA, UVB, visible light. We've got heat, infrared. We've got pollution, huge pollutions actually get into the body, create more inflammation.
Do we have a lot of pollution in Australia?
That's a good thing we've definitely got going with us. And the more I see what's happening in the rest of the world, I'm actually feeling very lucky living in Australia every day.
Yeah.
Politically, but we won't dive into that. But yeah, we're better than a lot of other countries, but it's still problematic. Then obviously nutrition is huge, not just what we eat, but how we eat it, and time-restricted eating. And then sleep and stress. And then stress to me fits in with exercise. So because exercise helps reduce stress and then also helps sleep. So there's 7 key factors were coined by some of my European colleagues as the skin aging exposome. Exposome meaning internal factors that literally are responsible for 80% of the changes in your skin the more time you spend on the planet.
80%.
So we can reprogram our skin's destiny.
Okay.
Yes.
That's good to know.
Within how we live and what we use on our skin. And then the use of complementary early intervention treatments cleverly, appropriately, and when you need them.
So those things would be like your, micro.
Yeah, so
needling.
micro peel's amazing. 1 minute once a week, radiant skin, designed for everybody. Yeah, look, skin, people's problems are sort of different. But as I said, 6 key skin concerns: aging, sun damage, sensitivity, rosacea, acne, congestion, dehydration and pigmentation. Like most people have got at least 3 of those they either have or they're concerned about. So you need highly effective, simple, because too many steps creates problems and chaos skin that works with you and all your concerns, which is what I've spent the last 20 years devising. Highly boosted with niacinamide, every proven. So we go for proof over promise, facts over fads, and expertise over influence in everything I do. And I've been nicknamed the uncompromising dermatologist. Not because I'm not good at negotiating or I won't work well with my patients, et cetera, but like I will only make what matters and I'll only advise what I know I can tell you will give you the
and
right
you're not going
aspect.
to jump on those trends.
No. And it's hard. Sometimes I'm gaslit and go like, did I not read those texts right? Snail mucus, for example, there are no snail farms. They're not. And snail mucus is hyaluronic acid. And hyaluronic acid is actually a really mediocre moisturizer that just is built from the marketing aspect of the backbone of fillers in filling substances that now it's become a trendy skincare ingredient. The certain molecular aspects of hyaluronic acid are good, others are pro-inflammatory. So in fact, good old glycerin is a better moisture binder and a primary humectant. Hyaluronic acid is secondarily. I'd never make a hyaluronic acid serum as a result of that. Would I use it as an incipient ingredient to pair up with others that I know are excellent, clinically proven, proof over promise kind of ingredients like glycerin? Yes. Would I specifically rely on that for hydration of my skin? No way. So it's a very confusing landscape because as we know now, particularly since COVID, the beauty industry is kind of nearly $1 trillion global industry. It's definitely in the billions. And like famous people, private equity, shake and bake, you've got a brand and you can flog it for $100 million to somebody else, to one of the big corporates. So it's a formula for money and success. But I think we're getting so saturated now, the market's changing. So I'm hoping that expertise over influence and facts over fads and proof over promise starts becoming more grounded from an authenticity and integrity point of view. Because I think patients or consumers are more confused and overloaded than ever. And one of the things that I really, really, really get agitated about is death by TikTok. It used to be death by PowerPoint, right? Now it's death by TikTok. And I don't know, it took me like my
This will be
entire...
going on TikTok, by the way.
This will be going
great.
Well, we need sort of formidable people on TikTok
Yeah.
to kind of re-educate, which makes, I think, our jobs even more exhausting. Because despite seeing your 30, 40 patients a day and going to all your conferences and keeping up your CPD points and trying to stay registered and credentialed, then to have to deal with misinformation, it's really tiring. But if you don't do it, I think then the general public are at danger of getting misinformation and harm and self-harm from things that probably may not be beneficial.
And they could be doing more damage to their skin.
100%.
And it's also, I think, with these conversations as well, it's great to put it out there. But for me now, when I approach certain things, it is about doing my research, not getting one opinion. It might be getting 2, 3, 4, 5 opinions before I want to make that decision on what I want to do.
Absolutely. I have the rule of threes, whether it's in business or whether it's, say, I'm referring to somebody for a surgical procedure or with my patients. I'm like, I want you to see these 3 people. I want you to ask all your questions, and I want you to kind of listen to yourself and your intuition to how you feel about who you want to work with and what makes more sense to you, okay? So 5's even better, but at least 3.
Yeah.
And I think the issue is because this information now is unsolicited, and anybody, just because you've got, for example, in my game, skin, people think they're an expert. I mean, skin is also known as the integumentary system, which includes hair, nails and skin, is the largest organ in the body, but it also is the most complex specialty to deal with. It's innately linked to every single other organ system, and particularly the immune system, and it's super complex to study. It's highly competitive to get on the training scheme, incredibly intense academic, and it's complex. And I remember going from medical school, which I was an honours graduate, so, I kind of did okay, and getting on the dermatology training scheme and thinking, oh my God, everything's red, round and itchy. This is so complex. Everything I've learned in med school doesn't really help me. It's like starting over again. So when I hear a lot of these people going, oh yeah, they're a skin specialist, I'm like, well, you might have an interest in skin, but the really only true skin specialists are dermatologists. And to get through that's an additional 5 to 6 years training on top of a 6-year med degree, plus your undergraduate experience into, I did ICU, anesthetics, and a lot of other things because you must do hospital training before you can get onto a training scheme. So you've got a wealth of knowledge. But so, yeah, being a specialist and board certified versus not, there's a big journey in between.
What's some that is just driving you crazy right now?
Tanning. A tan is not a healthy tan. A tanning is a sign of your skin cells screaming out. You remember Wicked Witch of the West? I'm melting.
Wait, is tanning back? Is that popular?
Yeah, well,
Is it?
apparently Gen
I thought that was
Z and
out long
alphas.
ago.
Clearly I'm not.
Yeah,
on
and you
TikTok.
see, and it's cool to have tan marks.
that's
Tanning is a sign that your skin cells are dying. So what a tanning response is your skin cells are going into a proactive defense mechanism to make the pigment, which is the tan called melanin, to try and give you more UV defense so you're not going to get skin cancer, let alone Pac-Man coming in with all these activations of skin enzymes in the dermis where your lovely plump collagen, elastin fibers sit, and munching them all up so you end up looking like the wilted Wicked Witch of the West with not much substance to your skin. And so and what you do when you're young starts manifesting 20 to 30 years older and will set you up for the rest of your life. Now, yes, we can do with technology and definitely laser-based devices and certain technologies. The CO2 erbiums are the gold standard of replenishing collagen and elastin fibrils in the skin, reversing skin aging, and actually also cleaning up bad cells in the skin called zombie cells, preventing skin cancer, getting rid of what we call sleepy cell senescent, all of that stuff. Those are go-to treatments, and we can do them. But still, prevention is better than cure. As Benjamin Franklin said, an ounce of prevention's a pound of cure. A lot of these things we've known for 100 years, but we've stopped listening and we've kind of gone backwards. And I think our education campaigns have just stopped educating.
Yeah.
Is that why you think it's not
Yes,
really?
remember Slip, Slop, Slap? And then it was really successful back in the 80s, whatever. Then government stopped doing it because we get really good at it. But then the next generations miss out on education, so we go backwards again.
And now you're not allowed to promote sunscreen.
I know.
Like,
I know. Well, that's interesting, and that's a whole other topic because some sunscreens are actually good and some are not. And there's a big expose coming out that I've been engaged with the only testing facility left in Australia, because a lot of Australian companies, even though they're made here, they send their products to get tested overseas.
What?
Because the testing is not as stringent, but they can still get the ratings that get the tick by the TGA. So there's a big expose coming out with Choice magazine. They tested about 20 50s that are not 50s, particularly these mineral-only 50s, incredibly hard. And one was a 4, and many might have hit 30, but no one hit 50.
That scares me. And
And they're Australian-made, but they're not tested in the lab here. And a lot of them are very trendy brands that are sold at very trendy places.
Yeah, it does really scare me because when I go and I want to buy a sunscreen, I don't know where to start. There's so many there and I want a sunscreen because everyone's always telling me I have to wear sunscreen. I know, but I'm just bombarded with so many. And it is a little bit daunting, and that goes for all skincare. I don't know what to choose, what's right for me. I think it's really important to go speak to someone, and someone who is a specialist like you.
Yes.
But what are some tips that you could give people when choosing things like sunscreen and skincare?
Okay, where do I start? I mean, you've got to understand this is a labor of love for me because I started formulating, and as a consumer myself, then who finished med school, then who did an undergraduate term at Harvard University. And back then the dollar wasn't 60 cents to the US. And the variety of skincare in the US, and I was based in Boston, was far greater than here. And so, and cheaper. So I rock up to Lancome, right, I'm 21, and go like, oh yeah, I buy the eye cream, the neck cream, the toner, the lotion, the everything. Fast forward a couple of years, I'm on the derm training scheme. I fall in love with the pharmacological dermatology texts. I'm reading all about active ingredients, and you need certain percentages and combinations. And I'm like, wow, like these high-end brands have those ingredients in tiny bits, which is going to give you nothing, and they're $200-something a jar. But what I need to give me the results that I want as a consumer should be this. But then the stuff that was available in the right kind of formulations to a point were like in hideously like clad glue, Perkins pasty formulations. I'm like, there's a marriage here to make higher concentrations, good combinations, simple skincare in feel-good combinations that work for everybody. So 20 years later, that's what I've achieved. So, and there's fundamental principles of skin physiology that is the same. We all need to cleanse, but like gently and not overdo it. Another big mistake people make.
How often?
I say morning and night. I know some people once. I like morning, wakens my skin. And the cleansers that we do also have anti-inflammatories, antioxidants, and hydrating factors. So you hydrate while you cleanse so it doesn't strip. Really important. Overwashing the skin will put your skin into a reactive oil overdrive and will also break down your skin barrier and can create all of those skin problems I just talked about, right? So super important. And people underestimate the step because cleansing just seems so basic, it's not sexy. It's actually one of the best, most fundamental things you have to do.
I'm scared to say I don't cleanse, but I want to cleanse. So
okay.
This is...
Don't worry, Anna. We'll give you a goodie. I'll send you a special care package, both of you. Okay, it's all done. It's all done on me. On me. No, we'll share the love because one of our key is not just about efficacy and integrity, but we do care.
Yeah.
And then I think people, moisturising is super important. A lot of men, particularly from a belief system, because the way they're cultured, not because the Y chromosome tells them this. Most of our behaviours, we're born 98% the same, and then society just tries to make men and women so much different, right? We're actually got the same internal needs once we strip the onion layer back, okay? Moisturising is really important, but doing it well so it's not too greasy, not too heavy, but tissue integrates with clever combinations of water-binding ingredients like humectants and then mixed with things
what
like—
is that?
Humectants are ingredients that help hold moisture into the skin and build the barrier functioning, okay? So humectants, one of my favorites is glycerin, but also things like shea butter, cocoa glycerides, skin identical lipids like ceramides. So I use all of them in the one formulation because then that way you're getting the best of the best and you need less products. Less products means less steps, means people will be consistent. Consistency equals results. I parallel looking after your skin each day needs to be like going to the gym then eating well, right? If you go to the gym and do McDonald's, ridiculous. I parallel getting skin fit like getting body fit. That first 6 weeks, it's really hard, right? But then once you get to your right level weight, you know, those few crunches in the Pilates doesn't feel so bad. You don't really need to go every day. You go 3 times a week and you get a nice balanced equilibrium. Same with skin fitness. You know, 4 to 6 weeks of getting your skin, if you've got some problems, reversed, then hit repeat, 3 steps morning, 3 steps evening. And as I said, I do recommend our little micropeel because that gives keep people fiscally fit, giving them the option rather than running to clinics to do something clinically strengthened as rewarding at home means if we do some treatments, they can maintain and sustain in the comfort of their own home and economically affordable.
Yeah.
And 4 to 6 weeks.
Yeah, 4 to 6 weeks is usually
quite easy to do.
Now, I'm not talking about like severe inflammatory cystic acne that, you know, because acne is a disease or dis-ease of the skin, right? That's where disease comes from. It's a dis-ease. We've got to look at all the factors, hormonal, et cetera. But in general, I can usually restore balance into people's skin within that time frame. And it mightn't be 100%, but they'll be 80.
Yeah.
And then and that's why I've really consciously tried to make things simple because when you've dealt with unwell people and you look at people's capacity to be compliant, it's not great.
Yeah.
So if we keep things simple, easy, and it feels good and it works, people then just keep ticking over. And cadency and consistency is key to all our health habits, all of them. And then hit repeat.
Is looking at it from a holistic view or even
Yes.
recommendations of what you do in your practice something that you're recommending to your clients in terms of, especially if they're coming in with something like acne and, you know, they need to go, okay, well, maybe it's the gut, maybe it's hormone.
Yes, no, absolutely. So as part of my ancillary of questions, I ask about their life. And I often I can read there's something not right in their skin. I mean, I remember picking up on one of my divine patients who's quite senior at Amazon. I love her to bits. And I said, what's going on in your life? Are you stressed? And I didn't actually know her that well. And she had this perioral dermatitis, like it was all going, so I'm always stressed, you know, I've got a high-powered job and this and that. I worked out she basically was in a very toxic, damaging relationship that was undermining her sense of self-worth. Yeah. And so all her adrenal hormones and cortisol and she had underlying anxiety. When she got out of that and the fact that we treated all the acute symptoms and then got her skin back in balance and now she's out of that, skin turned around and she's in a really happy, she's about to get married to somebody who's the antithesis and is healthy for her. So your skin tells your internal and external story and it really is more than skin deep. And I think having personally been through things myself, I can pick that up from an intuition point of view as well. And so I do look at people's lifestyle. I generally check in what they're eating, right? And I'll point out if I think things are negative. I work hand in hand with the professor of metabolism and endocrinology, Professor Kathy Samaras. So I always screen questions for like PCOS, right? Because you can not have the cyst on the ovaries, but you can have, it's a syndrome. It's not one test. So and often the doctors they've been to haven't done a couple of tests, so they miss certain diagnoses. So I make sure I do all those batteries to make sure our baseline's great. And then also check for some people thyroid or even thyroid antibodies. Iron studies might be normal, but your stores will be low. And then if the hair's going, a bit of iron supplementation, changing diet. I look at all of it comprehensively because that's how I've looked at myself. And I've also worked with a nutritionalist over 15 years ago before all this stuff was trendy. I met her when my horse was stabled, ironically, up at Centennial Park for a little bit when we were like looking for a home for him again back in the Highlands. And she loved my white Arab because she had an Arab when I was a kid. The next minute we're riding together and she educated me back in 2008, 9, all about how nutritional support means mainstream medicine should be hand in hand. Yeah. So I learned a lot about supplements, but what supplements are really, really important because supplements are exactly that. They are a supplement. They aren't a diet replacement. And I think in our busy day in life, right, and you guys would know a lot about this as well, you know, most of the answers are in food, but knowing we can't always get them, but certain supplements you can't get in the necessary nutritional amounts you can get in food. So a great diet blended with that, and then that will reprogram your gut. And a lot of food substances are natural probiotics. Yeah. So I think gut health is like the skin's linked to every organ system. All our organ systems cross-communicate. So to me, like if gut health is important, but that comes down to a good diet and less processed foods.
Less stress.
Yes, less stress.
Better sleep.
Well, the neurons in the brain, and if you're highly intuitive, which I've been, which was really hard when you were younger because you just thought you were crazy, right? You know, if you could sensitize and feel people like either talking about you negatively or your gut was on or you'd sense things weren't right. And that was just probably because you're a very highly empathic, highly emotionally intelligent person, which we now talk about. And now I know, so my gut was one that would then literally give me like gastrointestinal hurry, meaning when I was stressed, everything would just fast process. Whereas some other people, when they get stressed, they comfort eat food, right? I think most people are either one of two things. But then I realized that your neurons in certain areas of your empathy areas in your brain and your frontal lobe and the gut are bioidentical. So if you're integrated, they talk to each other. And that when I started reading about that, later aspects of my life as we started sharing and understanding more of this. And now everything's interconnected. Like I found that absolute so validating and so relieving.
Yeah.
Well, I've had rosacea, and I don't know if that's the right way to say it. I've had rosacea for the last 10 years, or I've noticed that I've had rosacea versus like I've had it my whole life and it's in my system.
Yes.
And I now just know that the gut plays a big role in that. What sort of skincare tips and advice for people that want to tackle something like a rosacea? Like I even have a friend who's asking for her mum, like, what are you doing? And I can't give those answers.
Yes.
Because I don't really know, apart from some key factors that I've been told when it comes to the sun, what I eat, certain things that trigger it. But what else can I be doing? And especially when it comes to skincare.
Yes. Well, I have rosacea too.
So does that mean you have rosacea?
Yes, you
for
have.
life?
It's a genetic. It's like I've got blue eye. It's a genetic predisposition, but remember, we've got 80% control based on lifestyle factors. Okay,
So you were
Goes with everything.
born with it?
Well, you're just got pale skin, you're pale skin, blue eyes, right? We grew up in sun, and you probably noticed, and I look back, and I picked it up early in my 20s. So I navigated my lifestyle choices to get control over my predisposition. See what I'm saying?
Yeah.
And then I've never needed medication, and I've had a couple of vascular treatments to get rid of the fixed redness. Yes, I have been my own patient, definitely, and I won't recommend things unless I try things out on myself because I want to make sure I'm not a hypocrite. And I also want to be able to teach and talk to my patients about the pros and the cons and the recovery journey. So really, rosacea is a disorder or a susceptibility to going pink more easily than other people. So your flushes and blushes, right? So you probably found, Anna, that when you would do exercise in hot, you'd go quite bright red, then it goes down, then your skin was normal. Then over a period of time, you'd notice the redness was a bit more fixed. Then all of a sudden you could see a few little broken capillaries maybe, and then all of a sudden you're getting these little breaky out areas in those cheeks, and it's a progression, right? So for me, I picked it up in the flush, blush, pink phase and then went, all right. And I wasn't 100%, obviously, early 20s. It was rosacea, but I thought, I've just got to avoid things that make me hot. So air conditioning, Pilates, reformer over Bikram yoga, which for most people is better. I'm not going to poo-poo people's choices to a point because I understand they feel great when they come out of that thing. I did it once. I looked like a tomato that was like on fire, like an inferno.
But doesn't matter though. Like if you go into something like that and yes, you're getting the hot flushes, but does that not go after you leave and go into an air-conditioned room?
But it's cumulative, right? So each flush, when those vessels are dilating, right? If you're more a dilator and a flusher and blusher, releases inflammatory mediators into the skin, right? And then each time then it starts to build capillaries that grow there that shouldn't be there, right? Then when you've got more capillaries, you've got bigger flushes. Then you've got more inflammation. Then you get all what people think is acne, but it's not. It's inflammatory papular rosacea. So it's a progression, right? It's like eating terrible food and getting a bit fat and keep going and then wondering, where do these extra pounds come? It's like, okay, I better stop what I'm eating. You've got to curb your lifestyle factors. So flushing in the skin increases inflammation, which is not good for the skin. So hot yoga. So here's it. I'll go into rosacea because it's really complex and we're covering lots here and we can always come back and break things down. And
Because I'm just a bit worried because I did work out and my face was red and I was like, I haven't actually, because I didn't have makeup on that day and I noticed how red my face was, but I want to work out. I want to push my body. So I'm not going to stop working out.
So air conditioning environment, you can weight train and you can do reformer Pilates, right? And then here's another tip. Get a cool washer, soak it in water. And I've done this. I used to go to Shiva Som, Shiva Som, one of the original health retreats in Woking. Yeah, I was an early adopter. But the steam room was so hot, and I don't do steam rooms or saunas, and I don't really cold plunge, but that's my choices, and I can talk more about that. And there is an addictive aspect to them as well, and there's a great book to read on that, which I can share. So, but I wanted to go in the steam anyway because I just thought, I'm cleansing, I'm here, and let's just try the whole things and jump in the cool. So what I did is I took a bucket of ice, right? True scientist here, right? True scientist, problem solution. I got washers. I wrapped ice. I put them around my neck and I put them all over my face. So I laid in the steam room and I didn't get pinkness. I didn't flush. I didn't get one element in my skin.
It's a good tip.
It's a really good tip. So if you work out, cold washer, water, freezer, take it with you, put it around your head and neck area, keep your face cool.
And also I guess thinking about how those things make you feel. Like I know a lot of people
it's a high.
A sauna or an ice bath also to relax as well, or it's a high. So you've got to kind of weigh up what's going to work for you. And for me, I'll never not work out.
Yes.
And I will be pushing myself, but I think I've just got to, I know it because that de-stresses me. So then at least I don't have the stress that's then going to affect my skin.
Well, it's an endorphin release, right? There's a book called Dopamine Nation by Professor Anne Lembke, Lembke, clinical practicing professor, psychiatrist, Stanford. Amazing. And she literally breaks down in the book all about our dopamine and cortisol pathways and where it sits in the brain, and how that's why it's called dopamine nation, how we're all at risk of becoming addicts. And whether it's shopping, she was addicted to romance novels, whether it's sex addiction, whether it's cold addiction. And she actually talks about this really cool case study of a guy that was, in the corporate banking world, kind of partied and did cocaine and drugs, and then for his wife and his kids' sake, thought, I want to get clean. I don't want to do this anymore, and came off all of that and then got into cold immersion therapy. And in his therapy sessions, he's like, oh, yeah, I'm just having a cold shower. And the cold shower turned to ice baths, and the ice baths, he bought himself a meat freezer, and then he froze ice in that, and then he got an outboard motor of a boat, and because if you circulated the water in the meat freezer, you could drop the temperature even lower.
Oh my gosh.
Then he slept in a cold mat, and as she's telling the story in the she's sitting with a live patient, he stops in his tracks and he goes, oh my God, is this my new addiction? She's like, yeah. So I think the motto is everything's about balance, and everything speaks to each other, and we've got to look at our life like it's a big pizza, little pieces of the pie, and we try and be as healthy as we can, and we create balance across all of it. Yeah. So when it comes to rosacea, having the awareness, know that you're more heat, and when you get hot, as I said, little habits that help kind of curb your overheating. Choosing your exercises that wouldn't be Bikram yoga, that's going to be Pilates reformer and weight training. A bit of HIIT and high intensity, fine, but how much do you really need? And having calm, cool skin that's not inflamed is going to give you better skin for longer.
Then so are you saying that you will never get rid of rosacea?
It's a predisposition.
Okay, so these things we've just got to manage.
Yes.
Which is a little bit disheartening, because at the same time, I feel like I can manage those things to a degree. I'm not going to probably stop eating chocolate either, which
it's fine. It's 80-20 though. I'm 80-20. If I feel like I want to have a dessert and this and that, and I'm like, sure, because otherwise you can't sustain it being a purist, right? You've got to have 80-20. I love French champagne. Yeah. I say that's my low sugar option of alcohol, right? Vitamin C. So, but would I drink tons of red wine and sit in front of a fire and I'm going to go pink as a pumpkin? No, I'm not.
Yeah. That's my dad. But are there creams that we can be using?
So if we get things in control, it's like, again, getting fit, weight, gym, it's easy, right? But you've got to get into that. So the thing about rosacea, scrubs or mechanical exfoliation, over cleansing, so gentle cleansing is really important. Moisturizing with things that strengthen your barrier, because you're susceptible to, it's because rosacea is a barrier sensitizing or a barrier dysfunction disorder. So we infuse niacinamide into everything because it builds your natural ceramide levels. Ceramides are super power natural moisturizing factors that layer up and strengthen your barrier. It's also a potent antioxidant that's stable, so it reduces inflammation, and it sebum regulates for those who are a little bit acne prone as well. SPFs that are mineral over chemical tend to be more tolerant and tolerable with rosacea, because I'm publishing chemical sunscreen reactions at the Skin and Cancer Foundation. Minerals are inert, so if you're sensitive, they're going to be better for you. So looking for zinc and titanium dioxide. It's hard getting ones that aren't thick and heavy, but are also palatable and do hit high SPF. We have one that's got a tint iron oxide, so also does visible light protection, because visible light drives pigment as well. So we've got to protect ourselves beyond UVA and UVB, and also other aspects we now scientifically in the electromagnetic spectrum. So mineral SPFs, cleansing every day, cleanse gently, not foaming, not stripping, moisturize, key essentials for rosacea. Okay. You can use actives with rosacea, but once you've got stable skin. And there are certain actives like your AHAs and your BHAs and certain vitamins you definitely can use, but you must get stability. How do you know if you've got, because I remember one of your questions was around inflammation, barriers. How do you know your barrier's not damaged? If your skin's dry, flaky, itchy, breaking out, unstable and chaotic, you have a barrier problem. Therefore, you've got to stop everything you're doing, halt in its tracks, go back to simple, gentle cleansing, moisturizing, bring the calmness back into your skin. And then once the sensitivity is gone, there's no flaking, the skin's balanced, then you can add in some actives, and it's best to get somebody who knows what they're doing to give you that advice if you have access.
I want to go back to a comment you made earlier, which was about infrared saunas and that potential damage, because I want to talk about aging and healthy aging for the skin. What impact could the infrared saunas be having on our
Well,
skin?
all I can do is comment on scientifically we know infrared, which is just heat energy. So if we look at what comes out of the sun is on the electromagnetic spectrum, and we scientifically know that those wavelengths of energy also activate the same, what they call matrix metalloproteinases, which is why it took a long time to learn my degree, which is a fancy word for enzymes like little Pac-Men that chomp up elastin and collagen fibrils. So infrared does the same activation as UVA, UVB, but slower. Infrared also drives pigment production in the skin. So if you like melasma, my New York colleagues had an entire outbreak of their, high-end, very well-educated female clientele who were very immaculate in what they eat, what they used on their skin, and also their treatments. And they were all getting really bad melasma pigmentation because of infrared saunas and the whole trend of Bikram yoga. So heat for pigment is very similar to UV. And what is the best way to treat pigment? Never get it. If you don't get pigment, which means what you do in your early years of life is super important, the main driver of pigment is not hormones. Hormones will manifest it and it will exacerbate it, but it's heat and UV, what you do in your early years, that gives the programming to bring pigment out later.
Right.
And what are some common skincare habits that people are doing that you think that is a big mistake, that's a big no-no?
All right, where do I start with the list?
Give us your top 3.
All right, too many steps. Creates chaotic skin and like lots and lots of serums and things, when really kind of, if you're using the right things, one serum morning, one serum evening should be enough, right, to give your skin all the essential skin reprogramming, increasing skin longevity ingredients you need. Spray on SPF. Spray on SPF is an absolute hate. So first of all, spray-ons are tested in the liquid form at high concentrations on the skin in the lab. Then they're shoved in the aerosoler, then they're sprayed. So you are not getting what was tested. You are getting an SPF of maybe 4, but beyond that, all this topping up, people give it a false sense of security. They're going out longer and they're getting more damage. So not just skin cancer, worse skin to live in the next decades, so they get a false sense of security. So I think spray on SPFs should be banned. And if they're outdoors and spraying it on, you watch the wind and it's kind of blowing off into the environment. There's probably more on the seat they're sitting on than there is on the actual skin. And they love it because they feel like they're wearing nothing at all. And the irony is, because you probably are. Overwashing, foaming, cleansers, and acne patients going, yeah, I've got too much oil, so I'm going to cleanse more. And they use stripping, foaming things. All that does, it sends a biofeedback message to the oil glands going, wow. And if you're really tight and dry, you're cleansing too much, your skin should feel soft, hydrated, and clean. Not like I've got to get moisturizer on quickly and tight and dry, you're overdoing it. So all that does to your skin's biofeedback mechanism and your sebaceous glands is tell it to go into a reactive overdrive to make more oil, and then you go out of balance and you get more pimples and acne again. And Korean skincare trends, as I said, these guys never have a problem. They do not go outside, and I have some beautiful Korean colleagues who I've presented with, dermatologists, and it's hysterical because they put their before and afters. There's nothing wrong with their skin. We know 80% is environment. What do Koreans do? They sit inside, they layer up, they wear umbrellas, they don't play outdoor sports. Of course, their skin looks like their buttock for their entire life because they've got nothing to treat. So it's a little bit culty for me because I don't understand why did Korean skincare all of a sudden get this massive name? If you read the ingredients list, it's no different. In fact, some of the products are probably inferior to what we make here, and we make skincare here because we have to deal with the worst skin in the world. And when I presented in Aspen to cosmetic boot camp to my derm and plastic surgeon colleagues over there, I had this incredible collage of all the skins that I see, like the load of sun damage. They're like, oh my God, like, how do you find the skin cancers in this? Because they just don't see what we see. And I'm like, yep, we're world champions at the worst skin in the world, which means we're really good at treating skin and getting it great. So they're my kind of a few of my pet hates. So I hope that gives us some insights.
Do expensive skincare products always mean better results?
Yes and no. So this is a tricky question. So do I think $500 is worth it? Probably not. Having somebody also formulates, and I know the pricing of every single ingredient factor. But then do I think $100 is potentially better than the $25? Yes. There is quality versus quantity, but then there's just extreme. It's like, a Bentley versus a Hyundai, but then in the middle there's, I don't know, a BMW. There's a big difference. It's like economy to business to first, although I don't know, the first is nice. Let's face it. And sometimes nowadays some airlines, business does feels like economy, business wanting to be economy because they're just trying to make more money and cram you into smaller seats. But there is a quality point, and for ingredients when you use them, absolutely. But there is a point beyond that is just, I feel personally, tips into the extortion gig. And also that feeds just into paying for the marketing and the belief systems rather than necessarily giving you efficacy and results.
Is there any ingredients that you love that helps our skin produce more collagen?
Okay, so yes, look, collagen production, it's so trendy. Now you kind of like, everybody says makes collagen, do this, makes collagen, sleep makes collagen. The true cornerstone, so let's break it down. So what is scurvy? Scurvy was bleeding of gums and bruising and thinning of skin because vitamin C, which you remember they had no fruit and veg, right, is imperative for collagen production. So these guys, all the mucous membranes which like fragmented, all their skin bruised because collagen's really important to like create resilience in your skin and support blood vessels, and then wound healing really important. So diet's super important. Vitamin C topically is super important, but it's not everything. Niacinamide is excellent with C because C doesn't last as long in any product. I don't care what format it is. So putting it in, which is what we do with niacinamide, you've got 2 bioactive ingredients that are compatible that will stand the test of time and continue delivering and going beyond the shelf life. Vitamin A, I like prescriptive vitamin A. You know why? Because it's got all the studies and it works, and you just do it a couple of nights a week. You won't get sensitive. Put it on after moisturizer. So I recommend it in the 3rd step of our night routine, pea size, 2 or 3 nights a week. AHAs and BHAs have proven for 25 plus years of academic biopsy proven research to be shown long-term increases HA and collagen. And let's not forget, not just making collagen, right, with what you're putting on your skin and obviously, but preserving it, what eats up your collagen and breaks it down. So you want to sustain production, preserve it and stop it breaking down, SPF, and not going and being really smart about sun exposure. So really good SPF every day. The biggest cause of damaging your collagen skin aging is the environment, particularly UVA, UVB, and now probably heat as well.
Unfortunately, we have to wrap it up, and we could speak to you forever.
No
It's been
problem.
so
I'm happy
insightful. You can definitely come back.
I would love to come back. It's
100
been
more
beautiful.
questions.
Yes.
So thank you. But we're going to wrap it up with one last question.
Okay.
And what does it mean to feel great in your skin?
Me personally?
Yes.
What makes me feel great in my skin? I mean, I'm a no makeup fan. I know I've got it on because I'm on a podcast and that seems to be the thing you do. But for me, feel good in skin is to have healthy, glorious, high functioning skin that I can feel comfortable in. I don't need to cover myself and hide behind foundation. And from my job and my life and in my world, it's human connections, and it's making a difference to the people in my world and my patients, and seeing them evolve and their lack of confidence to coming out and feeling that they're living in the best skin themselves and watching the transformation in that journey. It's really quite amazing.
Beautiful.
That's a privilege.
That's so beautiful. Well,
Thank
thank you
you
so much. Where can we find you?
Okay, so my Instagram is at Dr Natasha Cook. My website's at drnatashacook.com. And yeah, DM, reach out.
We'll pop it in the show notes as well.
Yeah, thank you so much.
Yeah.
And it'd be a pleasure. And anyone's got any questions or like reach out, and I will do my best to answer them because I really do care about my community.
Oh,
and so thank you so much for having me on. It's been a pleasure. And yes, as you can tell, when I'm passionate, I can definitely talk underwater.
We love that.
Yes, we love it.
People.
Thank you so much.
Thank you very much for having me.
Thank you.